Hello, Ashley.
Hello.
My name is Mpo. I'm the midwife who will be looking after you today.
Yep.
How are you?
I'm alright. I came in because I've had some lower back pain.
You
So thought I might get checked out.
Okay, that's okay. How many weeks are you today?
32.
32 weeks. And is this baby number
2.
number 2? And what do you have at home?
A boy.
A boy.
Yeah.
Oh, exciting. Do you know what you're having this time?
A boy.
A boy, another boy. That's exciting. Yeah. And how have you been this pregnancy?
Pretty good.
Pretty good. Any concerns?
No.
No, that's all right. I can see that you've brought in your pregnancy record. Is it okay if I have a look at it? Just to confirm a few things before I ask you more questions about your back pain. Okay, just looking at your record, I can confirm that you're a healthy woman. You don't have any medical conditions. Yep, and just looking at your pregnancy results, your diabetes test was negative and all the other tests were negative. And you've had a morphology scan which was done and there were no abnormalities and the placenta is sitting in a good position, and which is good. And just checking on your blood pressure, it seems your blood pressure has been normal throughout pregnancy. Is that accurate? Okay. And have you felt baby moving as you normally would?
Yeah.
Okay, that's all right. And how about any loss down below? No. Okay. Now I'll get a bit more information about your back pain. When did it start?
Early this morning.
Early this morning. And when it started, were you doing any particular thing at all?
No.
No. I'm asking this because some women can have back pain and contractions as well. Have you experienced any abdominal pains?
No.
No abdominal pains. And have you taken anything for the pain?
I had some Panadol a few hours ago.
A few hours ago. And did the Panadol help?
Not really.
Not really. And can you describe more about the pain? Does it come and go or it's there all the time?
It's in my lower back and it's kind of there all the time, but it gets stronger and
Does it anything that worsens the pain at all? No. Okay. And when you go into the toilet passing urine, do you have any concerns?
No.
No burning or stinging?
No.
Yeah. Because sometimes, with backache, you can have, if you have urinary tract infection, you can have, burning or stinging when you're passing urine, and that could be a sign that you're having urinary tract infection. And I've asked you all these questions. It could be just back pain because of the hormones of pregnancy, because with pregnancy sometimes you get the muscles and the joints a bit weak, and some women can get a lot of back pain with the growing baby. So I will check you out though, just to make sure that it's not anything serious. So what we'll do today, I'll check your temperature, check your pulse, check your blood pressure, and check your breathing. And after that, I'll need to have a feel of your tummy, measure the size of the baby and feel how baby is lying, and also have a listen to baby. And I'll have to put you on the baby monitoring machine, the CTG. Did you have it with your last baby?
Yep.
No. Yeah. So we'll do that just for 20 minutes if all is well.
Yep.
Yeah. Okay. Do you have any questions before we start?
No.
All right. I've got a name tag here because you're in hospital today. Hospital policy, you have to put a name band on you. Before I put it on, do you mind confirming that you're Ashley Smith?
Yep.
And your date of birth is 30 July 96?
Yeah.
Do you have any allergies at all?
No.
Okay. I'll put this one out. And before we do everything that I've said we'll do, I'll need you to go to the toilet and give me a urine sample just to check again, because in pregnancy, like I've already discussed urinary tract infection, just checking to make sure that you don't have any urinary tract infection. And the other important thing is the protein, because if you have protein in urine, sometimes it's a sign that your blood pressure, you might be having blood pressure in pregnancy, or hypertension in pregnancy, we call it.
Yep.
Though again, protein can be a sign of urinary tract infection as well. In the bathroom, there are clear cups. If you can go there and, leave some urine in there, I'll check it.
I've just left that one in the bathroom for you.
All right, thank you, Ashley. I'll go and check it, and then I'll come back so we can do your observations and listen to baby. All right, Ashley, I've checked your urine. All is well. There is no signs of urinary tract infection or no protein, like I was saying before. And also I noticed that urine is clear, which is a sign that you've been drinking lots of water, which is good.
Yeah.
Okay, now just write that down before I forget. So now I'm going to check your temperature and your blood pressure. Here you can sit the bed up and be comfortable.
Cool.
I was wondering it's working.
It's like my legs are moving.
Okay, I'll also bring the bed up for my comfort, Ashley, just to make sure my back doesn't hurt. So if it looks too high for you. And I'll check your temperature. I'll put this under your armpit. Okay. And then I'll count your heart rate. You can rest your arm. It's okay. Yep, your heart rate is good, 80 beats per minute. I'll check your blood pressure now. Sorry, my hands are cold. Okay, you can rest your arm, Ashley. Your blood pressure is all good, 110 on 70. And your temperature is all good, 36.4. I'll write these ones down before I forget, Ashley. Now, Ashley, I'm going to have a feel of your tummy and listen to baby. I'll put this sheet over just to... Okay. And I'll have to lie your bed down for this. Do you mind putting your head down to your comfort, Ashley? Measure baby, have a feel of your tummy to see how baby is lying, and then listen to baby. I'm sorry, my hands are so cold, as you can feel. Apologies. Okay. It's looking for the top of your uterus. Okay, 30 centimeters, which is all good, because anything 3 centimeters above or below your weeks, is a cause of concern.
Yep.
Otherwise, it's all good. Now I have a feel of your tummy, just feeling at the top. Where do you normally get the kicks?
Around here.
Around there. Tell me if there's any part which is uncomfortable. Okay, I'll have a feel down below, Ashley. It's a bit uncomfortable.
Yep.
Do you want to take a nice deep breath for me? And out. Okay. Sorry, just confirming. Feels like baby's head is up here, which means baby's breech. But you are 32 weeks today, so baby can still move at any point. We usually worry when baby's breech at 36 weeks, so no need to worry at this stage. Now I'll listen to baby's heart rate, and I'll have to listen and count for a full minute just to make sure that baby's heart rate is good. Oh, baby moving. Did see that. Just looking for a nice. There we go. Alright, baby's heart rate is all good, Ashley. 152 beats per minute, which is normal. Anything between 110 and 160 is normal. Alright, Ashley, I'll hook you up on the baby monitor now. I've got these two bells that have to go behind your back. Okay, you can lie back. I need to just readjust them a little bit. Okay, so I've got these two probes. This one at the top is going to detect any contractions if you're having any, just putting it at the top of your uterus there. Is it comfortable, not too tight? You tell me if it's too tight. It's easy to make these belts tight for me. Okay. This pink one is going to pick up the baby's heart rate.
Yep.
There we go. That's baby's heartbeat there, Ashley. It's not too tight?
No.
Oh, good. Are you comfortable there?
Yeah.
Or do you want to sit up a little bit?
I'm okay.
You're good. Okay. All right. As you can see, that's baby's heart rate there. It's all looking good. I'll just press start so that we get the tracing. And like I said, you'll be on this monitor for about 10 to 20 minutes if the trace is looking good.
Yep.
Okay. All right. Baby looks good, Ashley. I'll have my hand on your tummy for 10 minutes just to monitor and see if you've got any contractions.
Yep.
How is your back pain at the
Still
moment?
there.
It's still
Yep.
there. And what score would you give it? 0 being no pain and 10 the worst pain ever?
Maybe about a 4.
About a 4. And you feel like you need some more pain relief?
Yep.
Okay. So when I finish feeling for the contractions, I'll go out, talk to the doctor so that he can come and review you. Yep. And so far, I haven't felt any contractions. So it's probably, the backache related to pregnancy, like I was saying. All right, Ashley, it's been 10 minutes. I haven't felt any contractions. I'll go out and talk to the doctor so that she can come and review you for some more pain relief.
Okay.
And before I go, I'll document everything that we've done about, feeling your baby. And I'll leave the CTG on for another 10 minutes. It's looking good at the moment, but just need to see a 20-minute trace.
Okay.
Okay, do you need anything before I go? All right.